As we continue with this topic on nutrition in geriatrics, calorie requirements decrease with advancing age owing to reduced energy expenditure and a decline in basal metabolic rate. The mean daily requirement is 1600 kilocalories for women and 2400 kilocalories for men. Protein needs for older adults. Most older adults require 1 to 1.2 grams of proteins per kilogram body weight. Protein is important because it helps to protect the muscle mass in older people. Use of proteins in the form of powders or drinks or shake is a very good option for the elderly people. Coming on to the carbohydrates, the elderly consume a large portion of the calories as carbohydrates, possibly at the expense of protein because of their low cost, ability to be stored without refrigeration, and the ease of preparation of carbohydrates. The recommended range of intake is 50 to 60% of the total calories. The food sources which include are grains, cereals, vegetables, fruits, and dairy products. A lot of fibrous diet is recommended, which can increase the GI or bowel movements for the elderly people. Intake of adequate amount of water, vitamin supplements or mineral supplements is required for the elderly. This picture clearly shows you the food pyramid which is important to be maintained for nutrition in elderly. If you see, an intake of minimum of 8 glasses or more is required for the patients, and least consumption of high caloric diet in the form of saturated or unsaturated fatty acids or any junk food should be avoided in the elderly. Diet recommended for new denture wearers are based on the days after placement of dentures. Coming on to the first post-insertion days, it is recommended to take at least juices or vegetable or fruit groups. Under bread or cereal groups, we have gruels which can be cooked in either milk or water. Under milk group, the patients can consume fluid milk which can be taken in any form. Consumption of meat groups, we have eggs which can be consumed or any processed meats or soup. The sample menu should contain a glass of milk at least once a day. Moving on to the second and third post insertion day, the same consumption of fruit juices or tender cooked fruits or juice without the presence of seeds is recommended. Cooked cereals, soft breads which can be boiled or boiled rice or noodles is recommended. Consumption of fluid milk or can also be given. In the case of meat groups, the chopped beef, ground liver, tender chicken or fish in cream sauce or scrambled eggs and thick soups is recommended. The sample menu must always include little or minute portion of butter or a glass of milk at least once a day. Coming on to the fourth day and after, by the fourth day or after, as soon as the sore spots or the patient is slowly getting adapted to the use of the prosthesis, the patients can consume a slight amount of fibrous diet or the patients can start using soft solid diets. These can be ideally cut into small pieces until the patients get used to eating with the help of the prosthesis. Unlike the natural dentition wherein we tend to chew on one side, with the help of the prosthesis, the patients are educated how to chew on both the sides or bilaterally to avoid the displacement of the prosthesis inside the mouth. By this way, it is strongly recommended that there is not going to be any nutritional decline by the use of dentures.